Thank you for the opportunity to answer your question in the context of this important conference. The effective delivery of safe and high quality care requires that those who provide that care work in teams and work effectively together, bringing their different abilities, skills and experience to bear to the work that they're doing at all stages. This impacts on the training of those individuals. In the past, the training has taken place mainly in uni-professional silos, but increasingly it's recognised that it needs to have an interprofessional element, and not just at the pre-registration or undergraduate level, but also throughout the continuum of professional training and practice. A further really critical element in this, which I don't think has been fully recognised to date, is the importance of the educators of those professionals also learning the additional skills that are necessary to be able to deliver that in a truly interprofessional way. So interprofessional learning and collaborative practice, or IPCP, is increasingly being recognised as important. And the role of regulators, I believe, is vital in this, because it's working alongside others to ensure that these skills are first of all incorporated in the training, but then in that collaborative practice. So I was delighted to see the recently issued PSA Right Touch Regulation document, which brings this up to date and has clear guidelines which are relevant to this. There are two aspects I think regulators can and should be involved in. The first is to reframe education and training, to recognise that these complementary skills in different professions need to be looked at in a much wider way, so that we can expand the scope of practice, for example, of professionals to work more effectively in the context of providing holistic care. And this has to impact on their training. So the concept of what are called credentials or micro-credentials is increasingly being recognised internationally and in the UK and the EU as a way to take this forward. So while not primarily the business of the regulators, they can have what I would call soft power to encourage, facilitate and ensure that these are taken into account. The second aspect comes back to the continuing professional development, which I mentioned as being critical to this, because it's very important that that is also taken on board. Regulators have, perhaps more than they understand, an ability to influence other key stakeholders in the way that they take things forward. So for example, the education communities. If regulators give the lead, as the PSA is doing through their recent publication and many of the other things that they have done, they can encourage others to take this forward in that broader way, which I believe will have an impact. In Ireland, we've had the opportunity to set up a little group, an interregulatory group. So the different regulators of health and social care in Ireland now meet on a regular basis. And we look at this agenda and try to see how we can take it forward in a collaborative way. And I believe that that is worth thinking about in the context of all of the work that we do, ultimately for the quality and safety of the patients we care for. Thank you.